Hey, good morning, Kathy. My name's Davis. I'm going to be your nurse for today. I have orders from the doctor to put in a urinary catheter tube. You've been retaining some fluids and your bladder's a bit distended, and I know that can be uncomfortable, so we're just going to try and insert this and alleviate you. So I got to ask you to confirm your name and date of birth for me. Okay. Do you have any allergies to betadine or latex, iodine, shellfish? Okay, that's good you don't. So we can go ahead and get started here. So what I'm going to do first is pull these back a bit and wash your private area. Okay. Now I'm going to throw these gloves away and wash my hands again. And we can go ahead and get you all positioned. Looks like you're already there. Good job. My urinary catheter kit over here. I'm just going to set this right between your legs. Open this with some sterile technique. Now I'm going to put on these sterile gloves. So Kathy, I have to ask, have you been on any vacations recently that were just super exciting? You went to Europe? That's ironic. A European vacation, if you know what I mean. Okay, gloves are on. We'll go ahead and set up these drapes. Drop. And I'll drop this top one right there. Okay, now what we're going to do is I'm going to get out this betadine. I'm going to move this over here a little bit if I can work. And I'm going to pour this betadine on my cotton balls. Let me go ahead and get this water connected. I'm just going to put some lube in this tray. Now, I think we're ready. I'm just going to hold my pressure right here. And we'll sterilize down here with the betadine. One more. Okay, now I'm going to get some lubrication on my catheter, and I'm going to insert it 2 to 3 inches. Now I need you to take deep breaths, then I'll go 2 to 3 more inches, and we're in. That was easy. So I'm going to inflate the balloon so it can stay. Okay, now I'll go ahead and remove this. And I would normally throw this away, but for the sake of the video, I'm going to set it right here to deflate the balloon when we remove the catheter. and I'm going to go ahead and tape this to your leg. Make my dependent loop. Since this catheter is being kind of ornery, I'm going to tape it again. Okay. There's your loop. Now, I'm getting good flow rate on this urine. It's light yellow, and I'm going to go ahead and clean up my field. But first, I need to take a sample. So, what I'm going to do is I'm going to remove these gloves. Wash my hands again. And then put on some new gloves so we can get a urine sample for the doctor. Okay, I'm going to go ahead and wipe down this port with an alcohol swab. And we're going to draw back a sample. Just put that in there very gently. And I'm labeling this and sending it to the lab. Next, I'm going to clean this up a bit, and I'm going to leave. But before I go, I'm going to go ahead and remove the betadine that I have down here. Alright, now I'm going to get you in a comfortable position, and I'll be back in a little while. So a couple days have passed, and I now have orders to remove the urinary catheter. So I'm going to come back in the room, hand hygiene. Hey, Kathy, I have orders to remove your urinary catheter. Can you please confirm your name and date of birth for me? Alright. Well, let me go put on some gloves, and I'm going to empty your urinary drainage bag here. Okay, you've got about 600 milliliters of clear urine, light yellow, so that's good. Now, I'm going to come over and remove your catheter. So what I'm going to do first is take a towel and put it down right here. I'm going to deflate your balloon. Remove the adhesive. And I want you to take deep breaths for me. On the count of 3, we're going to pull it out. All right. 1, 2, 3. All right, I'm going to wrap this in a towel and dispose of this properly. But I have a urinal in your bathroom, so just let me know the next time you void, and I'm going to put the nurse call light by your bed, so you can call me, and I'll be there. Now I'm going to remove these gloves, wash my hands, and that's urinary catheter insertion.